In the following scenario, the three individuals demonstrate risk factors associated with obesity.
Well, I'm trying to watch my weight. Great Friday night. I say so. My heart! Jenny! Someone's coming in so... Hey Bertha, bring me a donut. Jenny, you know better. Since your heart attack, there's no more donuts. No more pop. And we have a meeting with the nurse in half an hour. Time to go. Hi, Jenny.
Hello.
How are you today?
I'm okay. How are you?
I'm good, thank you. Are your sisters joining you?
Nah, they're just parking the car.
Alright. So do you know why you're in today?
Because I had a heart attack, and I think it's because I'm overweight or obese or...
Okay, so we're going to talk about how obesity affects your normal physiology.
Oh, okay.
Well, I was just wondering what led to my heart attack.
Well, for starters, your BMI of 33, which in turn is connected with your hypertension and high cholesterol. I also noticed you were diagnosed with diabetes 2 years ago, which could also play a role.
Oh.
Have you been having any breathing problems at all?
You know, I have been, and I kind of experienced some joint pain too.
Well, upon completion of my assessment, you're experiencing all signs and symptoms of obesity.
So what is obesity? Obesity is defined as having excess body fat accumulation with multiple organ-specific pathologic consequences and an increased number of fat cells. In order to be considered obese, your BMI must be over 30. There's upper body obesity and lower body obesity. With upper body obesity, you're often referred to as being apple-shaped. With lower body obesity, you're often referred to as pear-shaped.
Causes of obesity are overeating during childhood. This causes an increased number of adipose cells early on and will increase the amount of fat stored throughout life. This often leads to leptin resistance. Viral infection. There's a link shown between a particular cold virus that increases fat content. More efficient fat storers. In people, alpha receptors sometimes favor fat accumulation. Insulin resistant. The body may release cytokines that promote insulin resistance and less adiponectin, which normally promotes how insulin uptakes glucose. This means more glucose is stored, thus more fat will be stored. Income, culture, and genetic predisposition also can play a role in obesity.
In the normal physiology, energy input is balanced with energy output. This means that energy can neither be created nor destroyed. And by applying this concept to metabolism, the energy released by the foods we consume must be balanced with the energy we exert.
In obesity, the normal physiology is affected because the energy input is greater to the energy output. The BMI becomes over 30 due to an increased food intake and a decrease in exercise. This causes an increase in adipose cell size.
In the cell membrane, insulin binds to the receptor, allowing the GLUT4 receptor to be activated. The GLUT4 receptor uptakes glucose. In obesity, there's an increased amount of glucose entering the cell. Due to the increased amount of glucose, it is stored as fat and excess energy. It accumulates as it is not being burned off in individuals dealing with obesity. In the hypothalamus, there's an area in the brain called the arc that releases NPY and CART. Normally, NPY enhances appetite and CART suppresses appetite. Adipose cells secrete leptin, which indicate the amount of energy stored. As leptin rises, it sends signals to ARC through the blood to suppress NPY and stimulate CART. This normally should decrease appetite and promote weight loss. However, in obesity, people are resistant to leptin's action.
Wow, that was really eye-opening.
I'm really glad we came today.
Some lifestyle choices definitely need to be made.
Yeah,
Definitely need to help motivate each other.
I agree.
me too.
We've got this.
Treatments for obesity. Even though treatment may seem simple, there is no ideal solution. Maintaining a well-balanced diet and exercise are key components in managing this disease. Some treatments for obesity are often quite dangerous, such as water pills, certain diets that are low in carbohydrates, surgery, and diet pills.
Key concepts. Homeostasis is affected because of the increased amount of adipose cells present throughout the body. This increase in adipose results in overall negative health effects and an increased amount of health problems.
Proteins are affected in many different ways. Cytokines are released, which causes insulin resistance and a reduced amount of adiponectin. Alpha receptors often have an impact on fat accumulation, which often leads to obesity.
The cell membrane is affected because of it. If an individual is insulin or leptin resistant, these proteins are unable to enter the cell through the cell membrane, which impacts fat storage.